Welcome to Kian's Kiosk, insightful ruminations on the continuum of care.
Hi, Elizabeth. It's so nice to have you with me today at Kian's Kiosk. This is Elizabeth Parks. She's the president and CMO of Parks Associates and a colleague for many years and a friend for almost the same amount from even the past decade. It's great to have you on this session.
Well, Kian, thanks for the invitation. I'm excited to talk about some of the future of healthcare.
Me too. It's as I was preparing for our call together, it was really exciting to go back in time and talk about first how we met. So I'm going to share that from my standpoint. I had just founded Independa. It was less than a year. I think it was CES of 2010. And I happened to go into Harry Wang, one of your analysts at the time, his session around healthcare in the home. And for the first time, I heard an organization talk about the vision that I had for Independa. And I thought, wow, we gotta meet. And I met with Harry and got to know you guys. And we've been colleagues and friends and at your conferences and really impressed with all that you do since then. And so it's been now, 14 years. It's amazing how time flies.
It sure goes by quickly, and it seems like we're still talking about some of the same things.
Exactly. I don't know how you guys do it because while there's change, it seems like change is happening in the same direction that you've always called. But it never seems to happen as fast as we'd all either like or anticipate. But before we get into that, I wanted to ask you about how Parks Associates was founded. I know it's a family effort, and tell us about how and when and how it all came about and where we are today, how we got from there to here.
Sure. My mom started the company back in the late 80s, 1986. Early 87 is when she started the business. She had just finished a role at a company called Future Computing, where she was the vice president of research, and that firm got bought out by McGraw-Hill, which then moved that company back up to the Northeast, and my mom had just moved down from New Jersey to Texas, and so she wasn't going to, go back, and decided to start her own company, really looking at the impact of computing on consumers' lives. Back then, there had been IBM's vision of having a computer in every household in the country, and so she really worked at understanding the consumer adoption of computers and also the choice in deciding different technology and services in their home. So we studied the deregulated energy markets very closely in the early 90s and did consumer survey work on the choice of utilities and what was driving that choice, and have been surveying consumers over the phone back in the day, and then moved to online broadband surveys now, where we're doing 10,000 households every quarter and tracking adoption of all connected devices and services in the home. So the business has really grown up alongside the technologies with it, and I've been lucky enough, I'd say probably blessed, to work with my mom as long as I have. I am celebrating my 25th year of working with her this year in August, and it's an honor to work so closely with my mom for so long, especially in our business that we're celebrating our 37th year this year.
Wow. So she brought you in when you were 4.
Yeah, that's right.
That's wonderful. I was going to ask, when did you know that this was also your passion? Because I know it is your passion, and we'll talk about that in a second. But when did you know? What age?
Yeah, when I first started working for her, I was right out of college, and it really was, I was going to move back home and work for my mom for a little bit until I figured out what I wanted to do, and I have not transitioned to any other role. So in high school and college, I was really into journalism, and in fact, that was maybe a career path that I was considering in the editorial and publishing side. And so I think this work really aligns with some of the things when I was a lot younger that I was very interested in, and then the research work that comes along with it and understanding technology adoption and the business angles, the strategic growth patterns that we see with the technology curve and moving products to mass market has always been something that we've focused in on. So I'm not sure when it was real solidified that this is how, this is what I was going to be doing for my career. But I'd have to say that it's gone by very quickly as time does, and I have no regrets at all in terms of the commitment I have to the quality of the business and the research work that we do to help inform our clients with what they are interested in knowing about.
Yeah, and I know you're a research wonk, and I know you love that part of the business, and which is really foundational. It's core and gives you a lot of credibility and longevity, I think, with a lot of your big clients. So I see the same names there year after year, and I know they get, unique insights from all that you and others do there. And I know, of course, your wonderful husband Nick's involved. Anyone else from the family involved?
My children, they're ready. They're already asking me. I've got 3 kids who are almost all teenagers, and so they've all been asking me, Mom, when can I go to work? So maybe this summer I'll start getting them involved in the company.
That'll be wonderful.
Yeah.
I've met your mom a couple times at different conferences. I don't know her well. I'm sure she's amazing, and it was a great transition to you. But credit and kudos to you, Elizabeth. I've known the company through you and through your staff and through Nick, and you guys do an amazing job. So I wanted to cover that as upfront as I could, because I didn't know all the details, but I think it's really important that you guys have been at it for this long, and your commitment to excellence and all that you do really shows.
Well, I appreciate that, and that exactly that commitment to excellence, I think, is mirrors what my mom has really taught me from when I was a little kid. So
let's talk about your conferences. So now, fast forward to today. You guys have a number of obviously research areas and is it disciplines, I would say, and then you have a bunch of conferences that support that research and maybe even go beyond it. Tell us about the structure of Parks Associates and the various conferences, because I know you through one or two, but I know you do more.
The events that we host, and we've always hosted executive conferences and strategic workshops, and really any ways to bring industry leaders together to discuss their views and build broader consensus and debate over the growth areas that we're covering. So we have 8 different vertical markets that we're looking at with our research work, and our events align with those coverage areas. And we have expanded, introducing new events into the market as some of the areas have grown. So our signature event is our Connections Conference, the premier Connected Home Conference, which is in our 27th year this year. We'll be hosting it in Frisco, Texas, outside of Dallas, where the Cowboys are located at, and that is co-located with our Connected Health Summit, the 9th annual event that we're hosting. And I know Independa is a great supporter of both conferences, so we appreciate that continued support. In addition to those conferences, we also have our Smart Energy Summit, which is focused in on the utility play and smart home technologies. We have our Future of Video event, which is on consumer electronics and streaming video distribution. We have our Connections Summit at CES, which we've hosted for 17 years in cooperation with the Consumer Electronics Show in January in Vegas. And then this year we launched our inaugural Smart Spaces Conference, which is focused on the multifamily community living, multi-dwelling unit. So that does include senior living spaces, student housing, and some of the hospitality aspects. So those are the events we're hosting now. We also do virtual sessions throughout the year. We host webinars, and the events really go along with the mission that we have with educating the industry on others' views on the growth of the markets, as well as the research work that we're doing.
So now I'm going to bring it a little bit more home towards Independa and our involvement with you and Parks over the years, which is really where, in our view, healthcare happens, is in the home. And you've had a number of large telcos, cable, satellite operators throughout the years who present their long-term plans or even maybe shorter-term plans on how to approach the consumer from a health standpoint. Like you said, a lot of that doesn't necessarily move forward too quickly, but there has been some progress I've seen, and I think it's really, unless it's, I don't know, mirage, but I think more recently, last year or two, especially because of COVID, I think a lot more is happening in that space, and I wanted to chat with you about that. What are your thoughts on where sort of health in the home is today versus where it was, and where do you see it going?
Yeah, there's been a huge catalyst that we've seen the last few years with COVID impacting how consumers are seeking care and what they're paying attention to. So certainly the remote care was already in play, but COVID has really sped that up and changed the dynamic so much so that there's an expectation for doctors and providers to be able to have virtual consultations as well as different devices that can help track the market and the aggregated data that is coming through consumers, and then in the individual healthcare benefits that can come from a connected device. So we're showing that 55% of households now have a connected health device, and 65% of those show a willingness to pay more for a device if it can be connected and then monitored to provide information back to the end user or the consumer. So we're seeing consumers going out and buying these devices on their own, and then the ones that are buying those devices are going out and buying more. So the device stacking phenomenon is occurring with healthcare devices just as it is with smart home devices. And then the physician sending the devices home and enabling remote patient monitoring is also, I think, a real game changer. There's a lot to be figured out with that, particularly with various outcomes. But as we move towards a more health to home-based focus, there's a lot of factors driving that, including labor and cost and the volume of people that are going to need care, where technology really can play a huge role. I know what Independa is doing with the television is really unique and very interesting, given the role that the TV plays in the home, as well as the size of the screen, and now the importance of the platform of the television and enabling all these different capabilities through integrations. And I'm sure that's something more you could share with us on some of those details.
Thank you. Yeah. So, I mean, this is our corner of the vision that we share, which is, simplicity and integration have to rule the day. And I know there's a lot of standards out there, just even on the technology side, and there's lots of vendors and there's lots of services, whether it's health or otherwise. And in our view for health, it turns out that TV happens to be very disruptive as potentially the digital health device in the home because of the size, the convenience of consuming data, let's say, in a much more relaxed way. If you're a doctor, you get to see your patient be, fully, not just their nose and their face. If you're doing couples therapy, for instance, you see body language of both people. If you're doing family therapy, you see 2 or 3 people. If you're doing exercises, obviously doing it in front of a TV is so much more enriching, if not just even enabling, versus in front of a computer or a small phone screen or a tablet. And then you have macular degeneration for older adults. So there's all these factors that are leading to the screen format and just the consumption of information and data and video and services. One of our more recent partnerships is with Lucid Hearing, which it's surprising, but it's the world's first and only TV now, through our partnership with LG, that has a hearing assessment built in. So next time somebody says the TV is too loud, you can actually do a test and figure out if you need a hearing aid, and there's hearing aid options and so forth. And we're also uniquely providing WebMD content, medical grade content that you can't get anywhere else on the internet, to the individual in the home. So we definitely agree. Even lab tests coming to your home, and we have other roadmap aspirations to bring in, for instance, veterinarian support and physical therapy, and then getting to more vertical partnerships, for instance, for liver challenges or heart challenges in the home, so you can manage things very specifically. And we don't have to be on the TV, and we OEM the platform to others, and it could be on a tablet or a computer, but we do feel the TV gives health at home a big platform to build on.
Yeah, absolutely. I mean, there's so many consumers who still are watching television every day, even though there's this introduction of streaming services and connected devices taking over. The television still really is the primary form of a lot of communication, and so is seen now as a tool. Right? It's a piece of hardware that can enable all sorts of other things to happen. And I think in general, there's more of a holistic view of the patient, right? It's not just about now helping somebody when they're sick, but it's all about, it could be about being lonely. It could be about making sure you get up and walk for 5 minutes. We've talked about, just a 5-minute walk making the biggest difference, especially for older people in their overall health care. So it could just be a prompt to make sure you're taking your medication. So, we definitely see all of these different pieces of hardware as enabling the future of healthcare services, and also that data that can go back to a professional. And even in some cases, there's proactive, predictive, preventative types of things that are going on with some of the sensor-based technology being introduced.
So I remember one of the presentations that I gave, it was a few years back, the title of it, which is probably still my favorite, is The Consumerization of Healthcare versus the Medicalization of the Consumer. And that was at your conference. And really what you guys have done an outstanding job, which is very near and dear to our vision and mission as a company, is healthcare really is around the person. And we don't think the medicalization of the consumer is the right path, because that's where the system is today, and it's very expensive, and there's lots of lack of insurance, lots of challenges and so forth, and that's a patient-centric world. And I know a lot of times people get excited when they hear patient-centric, but I've never been that way. I think everything needs to be person-centric, and I might be a patient to one doctor for 20 minutes in their office and a patient to another doctor 6 weeks later for half an hour in their office. But the rest of the time, I'm a person. And getting that data, like you said, and being able to share that back and having me be the center of my own data, my own choices, my own services that are good for me, and being able to share that is needed, but do that at the convenience of my home is really what we think is disruptive. And it turns out I do think that whether it's COVID or in general, we were moving in this direction anyway, but it just got accelerated, that healthcare is coming to the home. I'll share with you that our Chief Medical Officer, Dr. Richard Della Penna, as he always continues to educate me, but early on he shared with me that as a doctor and a geriatrician, he learned early on in his career that healthcare happens when someone leaves his office. And so his passion was always around what's happening in the home, whether it's through home health or home care or a network of friends and family that support you so you're not socially isolated, which leads to potentially depression, certainly loneliness, and leads to self-neglect, medication neglect, and all sorts of recidivism back into the system at great cost and anguish. And all this has been proven clinically, and now we call it, SDOH. But it's always been there, and we feel like getting the TV to be the platform that addresses that as well as the other things that we talked about is disruptive and really helpful.
Yeah, absolutely. There really are so many things to talk about in terms of the consumer being at the heart of the matter, and that's a lot of what our research work is focused in on. And I think that the choice of care is going to just continue to become, that the place where consumers get to make that choice. And so it's up to the providers and the industry to present those options in a way to meet the consumer where they're at. And a lot of them are going to be sitting in their living room looking for technology to, and help enhance what they know about their, themselves existing, and then that future care as well.
Exactly. So maybe not off topic, but I'm curious. I'm sure you know about the bathrooms, the upcoming sensor bathrooms and connected toilets, I should say, not just bathrooms. is anyone sponsoring any of your events just yet? Are we going to see like Toto there doing a presentation on catching things early when you when you go out?
Yeah, we don't have the connected toilet people coming to this year's event. There are a lot of the physicians that will be sharing their personal views on incorporating health into the home and the remote patient care. So we're very happy to be getting the physician's view. We also have the chief client or customer officer of Optum. And so we will be getting that insurance view. We think that is also, of course, the reimbursements and all of the policies that go along with connected health devices become a critical component to pushing, the market forward in the interest of the consumer. So we've also got Electronic Caregiver. They're a very innovative group who has a robot type experience. We also have the broadband providers in the sense of ensuring the connectivity and 5G and all of the things, the requirements for connected devices for everything to work, will be at the event as well. So we're really looking forward to it, and particularly when we bring in the smart home side, we're really addressing home security play, the monitoring, fall detection, and other sensor-based technologies that are outside of the camera, which of course many consumers feel is very invasive, don't necessarily want to be watched. And so some of these new technologies being introduced to the market, sensing-based technologies, I think are going to be interesting to hear about at this year's event.
Absolutely. And early on, our platform, to that point, we integrated with health devices for thresholds and alerts, but equally so with IoT devices. Because if you're, let's say, you're a congestive heart failure person, I would say, not patient, managing your chronic condition, you might have to step on a scale and take your blood pressure and maybe take a medication every day. And there's thresholds against that and what happens if you don't and so forth. But you may also, somebody may want to know if you went to the bathroom, didn't come out for 2 hours, or if you didn't get out of bed till 2 p.m., or if you got out of bed suddenly 10 times last night and so forth. So all of that is that holistic view that you guys bring together as a conference and with your research. And, we're bringing together, in our view, from a technology using the TV, but really regardless of that platform. It's great to hear that insurance is going to be represented, doctors. It's really the holy grail is to have that remote visibility so you can catch little things before they become big problems in a consumer environment, not a medical environment, because the costs are just, 2 orders of magnitude different, and the convenience is nothing compared to sort of a medical solution. And yet, anytime we hear managed care, hospital readmission penalties, capitated payments, value-based payments, what am I missing? PACE programs even, bundle payments, if I didn't say that. All of these are just simply saying, I want to have visibility from you or to you from a distance, and I want to catch little things before they become big problems, which is the consumer.
Yeah, absolutely. I mean, the focus on wellness rather than sick care, I think, is where the industry's moving, and technology plays a really important role in terms of consumers understanding, how their bodies are operating. So, I mean, the advanced technologies that are coming into market really are amazing. And I think the caregiver side is huge. There's 25 million people who are who are either currently taking care of a loved one or who will be within the next 5 years. And so that is an enormous population to help serve, where, especially on the communication side, and just understanding that somebody's well-being is, okay, and having tools that enable that, I think are going to be continued to be put out in the market, and hopefully we'll see some of the insurance and reimbursements tied into some of these technologies as the clinical side comes more and more into play, proving out the outcomes, which we know, of course, is part of the equation for insurance and medical care overall.
Well, what you guys do, Elizabeth, is not just collect data. In my view, I think you help guide with that data. So I see companies show up and listen and make decisions based on that. So it's really great. It's not just a passive involvement. You guys are leading the way, and it's great to be a part of that. I had a couple of fun questions for you. So as you did your research through the years, what did you come across that was maybe shocking that you never would have thought? Did you ever see anything or find anything that was like, oh, I would have never guessed that?
Yeah, I mean, there are so many things that we are ending up researching that are very, very interesting in terms of how things end up, playing out in the market. So, as far as shocking, I don't know if I'd have anything shocking. I think the reality of integrating different ecosystems is very complicated. And so despite we see willingness to pay for things and consumers embracing technology, getting some of these products into the mass market because of the requirements around integration for everything to work together is a big challenge. And so I think that's one thing I'd say is that we see great willingness and overall expectation now from consumers to have some of this technology available, and it's still upon the industry to make sure it works and it's simple and there's these easy user interfaces, and of course the mobile device being practically attached to every individual puts that app and the experience and the notifications in a very important position to engage the consumer with wanting to leverage the connected devices to better understand their own health outcomes.
So nothing too shocking. How about something that was really insightful that you said, wow, it either validated something or wasn't surprising, but just really maybe was more of it than you thought?
I think the pervasiveness now of broadband in consumers' homes, I mean, it's a game changer when that market has gotten as mature as it has. So we're showing 88% of households with broadband and 93% by the year 2025. That level of connectivity and then the Wi-Fi that goes with it, which is in practically everybody's home also, is creating an environment that will enable exponential growth across services. I mean, we are even talking about envisioning a world where perhaps when you buy a house, you could get the 5G dongle, with the purchase, and there's no wires connected inside. So the advancements in the infrastructure and enablement of connectivity, and then the standards initiatives like Matter that will really help bring all this together, I think will really push the market further than probably we've ever expected it to be. And then when you look at the role of AI and where that's going, generative AI as well as other types of AI that enable machine learning and other things to just happen automatically, it's going to be a pace of change that I think will, in some ways, be surprising, and then in other ways will take a long time, decades, really, to play out overall.
Anything you want to add?
Well, I just want to thank you for your great support of Parks Associates Research and the work that we do. I think that there are individuals like yourself who are constantly pushing the market forward with your thinking and perseverance in what you're working to accomplish. So maybe I just might ask you what you see on the horizon in the next 3 to 6 months. We've got a turbulent market. There's a lot of different things happening. Anything you might want to share with me on your thoughts?
Sure. I think, overall, people always ask me if the economy is going up, how does that affect Independa? If it's going down, how does that affect Independa? And the market is so huge and it's so untapped. And the value that we and other technologies along these lines might bring to someone are compared not to a cost of, let's say, a TV or a minor subscription, let's say, but they're compared to a cost of maybe $2,000 a month for home care, or lots of inconvenience and maybe guilt and anguish for family members. Or if you delay someone's stage of care by 1 month, let alone eliminate it, but you delay it by 1 month, you pay for the lifetime use of a service. So the ratios are so skewed towards the technology being adopted that for us, I think it's really much more about awareness now than, is it real? I think probably 6 or 7 years ago, is it real? 4 or 5 years ago, it was like, yeah, it might be real. Let me wait and see. And then since COVID, it's been, what do I do? How do I do it? What's the most simplest way? I think as you do know this very well, simplicity is really hard. So I think the most simplest, the most integrated, and the broadest solutions will win over time. So that's what we see. I don't think anything but acceleration is going to be ahead for us as Independa, regardless of the markets, regardless of whether VCs are investing or not, or private equity is doing the same thing as before or not, because we're comparing ourselves to such incredible ROI with the alternatives.
Yeah, absolutely. Very good points.
With that, Elizabeth, it's been amazing and wonderful to share this vision with you and this journey for over a decade. I don't get to see that too often or say that too often. Also, you're the last in the series for our podcast, so you are exactly yet another leader, as every one of the other folks, my guests, have pushed healthcare in innovative ways through the years, and I see exactly what you're doing with Parks is the same as what they've done. And so, kudos and congratulations for being a big part of where we're all going together with healthcare in the future. So thank you for all that you do.
Absolutely. Well, we appreciate you too, and it's always great to talk with you, Kian.
Thanks for making time.
Thank you.
Thanks for listening. We always would love to hear your thoughts and suggestions. You can leave them for us at podcasts@independa.com. That's plural, PODCASTS, at independa.com. And make sure you follow us on your favorite podcast platform. I'll be ruminating with more thought leaders on future podcasts and do hope to see you then. In the meantime, stay healthy and happy.